Do you have any examples? I mean, you mentioned something around access to medicine a little bit earlier in terms of a key area that pharmaceutical companies are focusing on. Do you have any examples, or could you perhaps sort of explain what does access mean and how is it measured?
So, interestingly, the pharmaceutical space is probably the most mature in terms of measuring their impact, right? I think the COVID-19 pandemic was a big driving force behind this, and it really highlighted the fragility of global healthcare systems. And really what COVID-19 and that pandemic highlighted was the disparities in access and accessibility to essential medicines across the globe. And what pharmaceutical companies have started to see is that there's almost two outputs or two elements when they look at the access to medicine component. Number one, it's really providing the right medicines to the populations that need it the most, with the population suffering the most from those burdens of disease. And secondly, it's quite logical. If they expand their access to their medicines, they actually expand their product portfolio and market. Right? So it makes sense from both a commercial perspective as well as a perspective of holistically doing good and resulting in better health outcome. And within the space for pharmaceutical companies in terms of access, there's three important components that we look at when we really support companies. The first one is their governance around access. So really, are the right strategies in place, and then are there the right KPIs and incentives to drive behavior within leadership to ensure that they deliver on those access promises? Secondly, from a research and development perspective, do these companies' pipelines really match the needs of the countries in which they're present? And lastly, there's the whole product delivery element, right? And this is where we bring in the appropriateness of supply chain, ensuring access to adequate and stable supply of medicines within countries, as well as ensuring that each therapeutic area or product line within a company has its right access strategy for a relevant country.
So it sounds to me like the measurement of impact actually has such a strong feedback loop into the strategy and the direction that the company takes around their business. Which is really, is so important, and measuring and quantifying these impacts really feeds back. Yeah.
No, I fully agree. So data and understanding your data across the entire value chain becomes really important, right? It's being able to link, specifically for pharmaceutical companies, what's coming out of a factory or within a production facility into the health environment. And I think where we as PwC play a great role here is across all three of those elements that I've mentioned. So within the governance and governance of access part, companies are really needing to have an access strategy, right? And that's where, with our understanding of the market across the continent and South Africa specifically, we're able to really support with access strategy for the company as a whole. And then secondly, that feeds into governance, right? It's making sure that at a leadership level, the right incentives and KPIs are in place to deliver that across time. And then secondly, when looking at R&D, through our understanding and knowledge within the market and the disease burden, we're really able to help companies ensure that their pipeline meets the needs of the countries in which they are present. Right? Really, there needs to be suitability of drug portfolio to the countries that we're seeing. And at the moment, one of the big challenges we're seeing across global pharma is that communicable diseases are being ignored. Right? And from a Africa and regional perspective, that's still a big consideration. So there really needs to be an understanding that if you want to play within our continental space, you need to meet the disease burden demands. And then lastly, from a product delivery perspective, strategy also becomes very important here. It's ensuring that your drug portfolio and therapeutic areas cover all populations across the entire socioeconomic pyramid, right? So that includes having really good pricing strategies, as well as market access strategies for each therapeutic area. And also within this is the supply chain element. Right. We really want companies to ensure that there's adequate, stable supply of medicines. And with our supply chain expertise, particularly the work that we've done across national government projects within the space, really means that we have strong expertise in advising and really supporting strategy around supply chain and supply chain stability, particularly in a continent and region where adaptability is key.
So thank you very much, Pranesh. This has been a great conversation. You really have shared a lot of information. So just to wrap up, we have covered the importance of understanding impact in the healthcare sector and pharmaceutical sector, why access is so important, and why having a strategy that takes all these different areas into account is really, really important. And the measurement and communication of impact really strengthens your stakeholder relationships, and your interaction with the communities and governments and regulators as a whole.